Hi, this is Janesh.
And this is Pranab. You're tuned in to the 30-Minute Hustle podcast.
"30 Minute Hustle" is a community of performers with a story to tell. We believe that each individual has a distinct path towards achieving their goals and are obsessed to learn about their process.
As a platform to bridge the gap between knowledge creators and seekers, we hope their journey will inspire you to accelerate your growth. Welcome to the network of knowledge, mindset, and practice.
Hey everyone, I hope you're keeping safe. This week we're doing a special episode on COVID. Given the current situation in India is getting worse day by day, we thought we should get an expert to speak about it. We have Dr. Rachit Negi, the head of infectious diseases for Uttarakhand and Assam. He has also done his master's in public health from Hopkins, and I hope you enjoy this episode and also find it very informative.
I'm Dr. Rachit. I have done my MPH from John Hopkins School of Public Health, and then finished and then came to India and joined a lot of organizations, worked in different capacities, in different roles, from implementation to research, monitoring, evaluation. So I've done a lot. So currently my role is in PATH, so CHRI, basically it's a PATH affiliate in India. So where we are implementing G project, it's joint effort for elimination of TB, tuberculosis, it's one of the infectious disease. So we are implementing in approximately 10 states. So I'm taking care of 2 states, Uttarakhand and Assam. So Uttarakhand, I majorly work for 3 districts, and Assam for 10 districts. I work for in Assam. So where my PPM, when you say state PPM means public-private mix, because you have to work with public as well as private. So I work with both. My work is majorly the coordination between the public and the private. When you say public means government, and the private means the doctors, the association, the Indian Medical Association, the Indian Pediatric Associations, and lot many organizations. So my majorly work is in the coordination and then sensitizing about the program, the new algorithms or new treatment regimens have been introduced. So I go and conduct the CME. CME is continued medical education, in which I sensitize them about the program, the current the trend, what is happening in infectious disease, how many people they have to notify, because as you are aware, all the infectious disease has to be notifiable. You cannot notifiable. So it's under the Government of India guidelines. It has to be notified. So I, help them in notification, because there is an HMIS platform for the tuberculosis. It's called Mixture Portal. So it has an app-based system, the SMS-based system, and the web portal system. So every case which comes to a doctor and diagnose, either it's clinically or non-clinical diagnosis of TB, it has to be notified on that platform, HMIS, so that everyone, even from the district, to the block, district, state, and the national team, they're on the same page. They want to see how many patients are being notified. Plus, what happens? Central TB divisions every year give notification. You say the target to the state. For example, Uttarakhand, we got 32,000 notification. We have to, cash hold 32,000 people. They have an estimate, like they do the surveys, a prevalence surveys. They estimate from the population of the state how many people can be suspected of tuberculosis, and then they give the due to prevalence data, they give the number of cases, notification. So that is basically what we get every year from the Central TB division. So that's why we have to notify them. So this is my majorly work for Uttarakhand and Assam. Assam, I work majorly remotely, but of course, Uttarakhand, I'm based out of Uttarakhand, so I work majorly in Uttarakhand.
That was a very detailed description of what you do. For some of our audience who just want to know about how you got into public health and why public health awareness is so important as a study, and how you working in the public awareness and the public private the PPM, you said?
Yeah.
So how that came about, and how important that is, and about this public health awareness.
So, public health, I always have an interest to study first of all public health. My passion to study public health. Public health, because when I studied in Hopkins, everyone says, my professor used to say, when you step out of your house, everything is public health because, you're moving out. It's not public health, it's not about health. Health is a very holistic thing, right? It's road safety, it's how you are, sanitation, hygiene, because everything is very holistic. These are all social determinants, right? So, whatever determinants, like every determinant is interlinked. You cannot, like, it's education, it's your, whatever societal things are there, everything is, health is one of the component of it. You can't say health is, something separate or something you have to study separate, right? So public health is my passion to study public health. And then my aim was because, and to be very honest, thanks to COVID, because people have realized what public health is all about. Because in India, when you run public health, no one realized what public health is all about. Of course, work is going parallelly. Of course, government national programs are running. A lot of programs are going in this, throughout the nation. But people were aware, this is something public health. Now, when we do COVID, people have realized, how our health systems are, how, it's like fragmented health system. Because if you see the news and everything, you see the majorly the maximum chunk of utilization is the tertiary care. Big hospitals, big hospitals are there where they're involved, and the secondary and the primary level where you talk majorly about prevention. You don't give the curative treatment, you only give prevention strategy. So these are, quite kind of ignored. They are not, into much of system services, especially the primary level. Of course, the primary level system is so strengthened and everything is on routine, But the ASHA, AN, and the frontline workers who are working the grassroots level in the primary healthcare system, they're all overburdened with a lot of work like immunization. They are with now they have a lot of surveys also at the block level, at the village level. They have a lot of things. So public health is something very much diversified in the country like India. But of course, when you talk about health system, how it works, how it, the interconnection between the health systems. Basically, the systems are globally, health systems are everywhere the same. But the everywhere you see global, there is a very good connection of referral system. From primary to secondary, tertiary. What happens in India? People go direct to tertiary. Like even you're sneezing, even if you are having fever, you will, go to the hospital or probably if doctor says get admit, right? So what happens, every hospital has a limited bed occupancy when you talk about bed occupancy. So if you are admitted out of fever or something, which you can get it easily at your home, right? So you are engaged, you are, doing the bed occupancy is there. So this is the time when the country is facing current COVID. Everyone says that there is no beds, there is no, in the hospital. So the burden is majorly in the tertiary care. What about the secondary and the primary care, like the prevention? Because it's the second wave of COVID, right? From the first wave, every leader, everyone is saying about the, they are basically making people aware through campaigns, through print media, through IC material, through a lot of broadcasting on the televisions, advertisement, taking care of, the self, like Amitabh Bachchan is saying, right, you have to do hygiene practice and everything, right? But but when it's almost an year after, the first wave, second wave, so we have been shown like how prepared we were for the second wave. Probably we could have done much better.
Yes. And it's quite interesting that you spoke about how COVID has propelled the whole direction of how public care is looked into, and especially in a country like India where sanitation is also always put on the back door. This is a great time for our public to also understand what is cleanliness and what is sanitization. And I know it's an extremely difficult job what you do, because understanding from a primary level to a tertiary level and the transition of how healthcare is given across this medium is extremely difficult. And how are you getting these numbers, Doc? And how do you go into these places and convert this data to make sure that right decisions are taken from the top?
So there are a lot of dashboards, right? The government, especially when you talk about, people have realized now the importance of digital health, right? So they have prepared a lot of dashboards. If you say every state has made a state-specific dashboard for COVID data capturing. Plus, the government had HMI system. It was from 5 to 10 years back when the data was captured from the grassroots till, to the national level. Plus, there are a lot of surveys, the district surveys, the national health surveys, always being there in the, it's every government does that, right? But the thing was that converting that data into, it's just a raw data, right? Because everyone is aware. Sometimes, just to get the data, they have to do they just have to fill the numbers. But no one knows the absolute number because no one knows the universe, what the universe is all about, right? Because we don't know the universes, right? So that is something which we have to think about the data and how the data is captured, from where the data is coming in, how the data is converting into the, the bar chart, the diagram, which is helping the policymaker to make the decisions. So that is something very critical component, which we should, talk about because every data is not captured at a national level. It's coming from the grassroots level. It's getting filtered at, then district level is getting filtered, it then state level, then it's come to national level. So there are three systems which are, capturing data. So my major concern is about the credibility, how the credible the data is, who is capturing the data, what authenticity then when the data is coming, the problem with the data is confidentiality. Everyone is hearing these days, data leaking and everywhere. It's a very, everyone hears, so it is also one of the critical component because what information is captured, because every information, whether it's you, me, or anyone, we don't want our information to be, put on the public domain.
You don't want it to be skewed, or you don't want it to have
public domain. So no one should access those, because some information probably may be, very secretive or something very, which I don't want, even because if I'm sure everyone is aware that COVID has shown how much stigma is there, right?
Yes.
Stigma is also there, right? So if information gets leaked or something, there's a lot of stigma.
What are the different kinds of ways that you at Uttarakhand and Assam are tackling these sort of issues? How are you doing it differently?
So basically what we are doing, we are capturing the data. We are all dependent on the government system, because nothing you cannot make, on the chain at one night. You can't make the dashboard and capture data, because creation of that dashboard is not a problem. The problem is training, The training is a critical component. If you create something new, or if you add something new on a dashboard also, you have to train the healthcare personnel, because they have to go and capture data from the real-time basis. So training is a very critical component. So what we are relying on the old, whatever the dashboards are available. Probably we are adding few components. For example, I'll tell you in HMI system for the mixture which I was talking about, TB, right? So that is a very approximately 4 or 5 years old HMI system, right? So when the COVID came, now they have added a COVID component to that. When they are taking the patient's information, either the patient is negative or a positive patient, right? So that kind of, they are adding few features to the dashboard. So that is something which we are capturing. It's very critical. It's very critical times. Yeah. So that's the way only we are.
Absolutely. So when you dig into the data, especially around how decisions are taken for COVID, and how public has to be monitored, and if you look into the historical trends, how do you see this disease breaking into, and what is going to happen from your perspective?
So as you said, if you see the history says every 100 years a pandemic comes. Last pandemic was Spanish flu, which was in 1914 or 16 it started, 18 it ended. Because usually when the disease becomes pandemic, it takes around 2 to 3 years to get it normal. Because every country is having a different, and the virus is mutating, mutating sometimes within the human, and sometimes outside the human also they're mutating, right? So no one knows which kind of stain anyone can have. So I was reading a report just a few hours back in Chandigarh PGI. They have a sample, 61% people, what sample they have? They have a UK stain, right? So how come UK stain is so prevalent in India now? The people are, of course, because UK is quite far off. So how people are coming in, and in Punjab and Chandigarh, a lot of people come from UK, US. So they're bringing a lot of stains. So when the stain will come to India, probably it may mutate according to the temperature, according to the condition, according to a lot of things, factors play into the virus. So there's something very critical to say. But of course, when you say about most of a pandemic, and when you say from last what the Spanish flu was, so it takes time. Plus, what I think is we have to devise statewide strategy, because if you see the COVID numbers and everything, it's not, every state don't have the same numbers. And these are the numbers which are getting notified, There are so many missing cases also who are not even coming to the system, right? These are only patients who are coming and getting tested. So what is like? There are also people who are not coming system. Probably they are taking home remedies. They are be at home. Probably they are thinking that if we are going to get a test done, there may be a social stigma, and then so many factors play in actually. To be honest, so that is something we have to devise a strategy. And what I think is. Whatever vaccinations we have, India have now 2 vaccinations, Vaccine and COVID Shield, right? So what I suggest is we should vaccinate more and more people. It should be open for everyone. It should be voluntary basis. It should not be age specific. Because if you have seen the trend, now the new cases are coming into the people who are less than 45.
Yes.
Yeah, they're all less than 45, right? Because the reason is that because all have to go for work, they have to move out of office, they have to go for bread and earning, right? So everyone is going out, probably thinking that the first strain was majorly prevalent in the old population. So now the strain is coming to children as well as young population of the country. And as everyone knows that India has lot many young population. So they should have to change, the government have to change strategy. Now vaccination should be open for all. That is something.
So there is also a lot of what we call it, what we think, how we see it is a lot of public fatigue in terms of what we've gotten used to with COVID. Like when the first wave came, we took it so seriously, and now that the second wave is coming, we aren't really taking it as seriously as we should. So it's very what do you say? It's like a fatigue that we're used to it now, that we think that it is okay, we can still tide over it. But like you said, do you think this will continue as a 2-3 year trend? And if it does continue, do you think the vaccinations will also need to have like booster shots? And how do you see this? How do you see this as a vaccination side, and how awareness needs to be?
So to be honest, it all depends what the vaccination has, the people who have scientists have said that the vaccination, the efficacy of the vaccination majorly for the 1 year. It's one, then you have to go ahead for the shot. But the major problem in India is the population. If you see the speed what we are vaccinating, if you see the trend as when you compare the globe, we are the last people who are vaccinating. But it all depends on the population. We have vaccinated crores, but still the population is too much.
Yes.
So it is something very difficult to reach sometimes to people. Plus, if everyone is aware that even people are showing resistance. If I recall in between few months back when the vaccination rolled out, actually many of the people were resistant to get this vaccine.
Yeah.
A lot of vaccinations were getting wasted, to be very honest, in a lot of centers, because no one knows the side effects, and there was always, it's not about COVID vaccine, it's any vaccination. Whatever vaccination comes in, even in India, people are hesitant because everything is something new you are making entering your body, right? So probably some you will get some kind of, so it's a risk factor, to be very honest, for everyone, and vaccination plays different role in different people. Probably if I get vaccinated, I may not get fever. If you get vaccinated, you may get fever, right? So it depends on body to body, person to person. So it's something very but still India really have to vaccinate people on the war footing note, because at least with the first dose of the vaccine, because at least people get a little bit of some kind of antibody in the body.
Absolutely.
To fight.
Yes, Dr. Rachit, on point here. So another question that a lot of our audiences have also had is that how much vaccine can India produce, and how many people can get vaccinated? Because we are the biggest producer of vaccines in the world, but yet we're so slow in adaptation, and our population is not getting vaccinated on the war foot, as you just mentioned. So where is our national views on that?
So I'm not sure if you're aware, the news 2-3 days before that the Prime Minister said that we are I think 55 lakhs doses were administered and 66 lakhs was exported out of India. It was something in the news, right? So I don't know the absolute numbers, but it was something like this in the news, right? So that is something we have to focus. We have to, when the PM says Atmanirbhar Bharat, right? It talks about you have to be self-sufficient, right? First, then you have to vaccinate your people, right? I know every country is happening, but developed countries have different public health, challenges, system, and everything. But India has something very different. So what I've done, if you see the first wave, what first wave? They have done the reverse migration. People people have come from all the urban areas who are working out. They have all come to villages. So villages, the burden has been increased majorly on the frontline workers, right? And plus they have less access to the healthcare services.
Yeah.
So that was a challenge, So sometimes it's hard to reach areas. Sometimes they have to go and they have to see people. They have to, So there is something. What is a big challenge is, for example, if every population in India, like in the US, Canada, people are linked with social security number, right? So people know, they can track people easily. But in Aadhaar, we have a lot of challenges, Probably Aadhaar can be a good link, to at least track people, to get the vaccination done. But I'm very glad that, the government has created, Arogya Setu and Covaxin, kind of digital system in which we are tracking on the real time basis. At least people know, who are already being vaccinated now. So that is something, a big challenge for the government to manage so much of population. The population is one of the biggest challenge,
We've spoken and we've heard a lot about herd immunity, Doctor. With the current pace that we are administering vaccines in India, why do you see herd immunity? When do you think herd immunity is going to happen? And do you think that is the best way for us to tackle this?
So herd immunity is something when more than 75% of the population or 80% population will get COVID, right? Because then otherwise there's no herd immunity. And probably we are all living and we are not vaccinated at this. For example, even myself, I'm not vaccinated now. So it is my immunity who is acting, right? Because see, when I say about infectious disease, right? So when you talk about TB, if I say, so India says that 40% of people have TB. But it will only get into action when it's a latent TB, right? It's a sleeping TB, right? So whenever your immunity is low or you are immunocompromised, so the TB, you will get a disease. So that is same factor with the COVID also. So people whose immunity is weak or who have undergone surgeries, who have undergone any transplants, who have undergone, who have comorbid conditions, so they're catching the COVID quickly as compared to the other chunk of population. So that is. Herd immunity plays an important role, but it will take time to get herd immunity.
So in terms of the herd immunity going on around different, are you seeing different clusters getting more immune to this? And especially there's a lot of movement of from urban areas to tertiary areas. So are these clusters developing rapidly, or what's your views on that?
You can say it is basically community approach, right? For example, I give examples. Everyone knows Dharavi. It's a very urban slum in Mumbai, right? So it was like a super spreader there, right? It was spreading, COVID was spreading very quickly there. So what I think, there is no study, to be honest, done till now, but I think herd immunity may have come in there. Because, because people live in so close community. If you talk about community, because there are a lot of urban slums. It's Dharavi is one of the examples, but in India, every city has so many urban slums and, in the outskirts of the city. So probably, at some point of time, they may have got, herd immunity. So herd immunity, I cannot talk about the country. I can only talk about the community, because any intervention or anything starts on the community. Like it's a closed environment where you live, spend time together, and it's very challenging, to segregate those people. To be very honest,
and in terms of like how other countries would have probably tackled this, like a good example would be probably Singapore, because the size is also smaller. Do you think we can get work on some examples that we can recreate in India to develop this?
We should replicate those examples. For example, in New Zealand, Australia, they have contained the COVID, right? Because they have the strategy. First of all, when the case came, they have stopped international flights completely. Until now, I'm sure you must have heard, the immigration is still very strict. They are sending very few. They are not giving the visa. They have restricted the entry on 2022. They have said that. So they have to devise the strategies, right? So plus, of course, vaccination is something which they are doing. That is fine. But of course, they have to, the inflow of people, who are coming in the country, that has to be stopped. That has to be majorly stopped. These countries are very small, very, population. The thing is that there, if you see, the houses are also very, far. It's not that, close clustered houses are there. So there's a lot of, so actually people are doing social distancing. Of course, everyone says from starting social distancing is one of the key strategy, for this disease. Not COVID, every infectious disease, actually, to be very honest. You have to social distancing. Like for example, if you see anyone coming from, like, not when COVID was not there, I'm sure when you see tourists, a lot of people from Japan, a lot of people from China, they always used to wear masks. We used to say, why they are wearing masks, because there's nothing. So the thing is that these kind of, pandemic was epidemic in the country. A lot of people, like it was not global, but of course in their own country. It's not like that they are, scared of pollution or something. But of course, China has more pollution than India, but they are only scared of infectious disease because there is a lot of, eruption of infectious disease when they are in their own country. So they were quite cautious, to be honest.
Do you think vaccine passports are going to really help in sort of at least people traveling from at least essential people who need to travel to meet family? You think that would be one way to go about it?
Vaccine passport are fine. If you have heard of, there's a yellow fever in Africa. So there's a yellow card, immigration card, which you have to declare that, you have got the vaccination of traveling to Africa. So that is something kind of thing which they can add as a checklist. So that is but of course, it can only be tracked if it's digital. Because in India, everyone knows that a lot of forgeries also there. People are getting negative reports. They are requesting doctors to make negative, because they have a lot of commitment. People have to attend marriages, you have to travel, you have to everything. So, yes. so many people, they take a lot of other channels to get the things done. But of course, if it's digital and if it's linked to something like in social security number in the US, Canada, if it's linked to something like Aadhaar or some kind of a digital card can be given.
Yeah.
For example, now the government has rolled down the National Digital Health Mission, NDHM. So probably if something linkages can be created or model can be created, for creation of a card, Ayushman Bharat card, for example. So something if things can be integrated, it may be a good, to movement. I will not say vaccine passport for outside, but I'll say vaccine passport even to travel within India also.
Okay.
Got it.
Yeah.
Yes. And being vaccinated is another one thing, and I would like to get some insights on the efficiency of vaccinations and also the efficacy of vaccinations made in India, or what we're being addressed to.
So efficacy in India, as everyone knows, that efficacy, they have done a lot of trials. Some trials, because due to the COVID was coming so high, probably some clinical trials, they have to stop, and then they have to administer the vaccination, and clinical trials, the third stage was running parallel, and they have been started administration. Efficacy is, they have, so they say 70%, 65%, 70%. But to be honest, it depends on person to person, because everybody takes a vaccination, because there is, inbuilt immunity also, right? So it depends on how much, you are doing the vaccination, how much you are, you are taking the vaccination, and then how much immunity is increasing. So probably if the immunity is weak for one person, probably taking one shot, right? Probably his immunity will increase. Because the ideology of the vaccination is to increase the immunity. A part of immunity, government has also said that you may use Ayurveda as a, to increase immunity. You use the haldi, you use, lemon, increase amla, use of amla and all that. So all that things is basically to boost the immunity. So once your immunity is strong, you will catch, you are less prone to the virus. So that was all ideas all about. So efficacy, as I say that you have heard in the news, a lot of people who have gotten 2 shots also, they are also getting COVID positive. They are also getting positive, right? So, but the symptoms are not severe. The symptoms are not severe. So vaccination is something which will make you safe. Probably when you talk about fatality, probably person will not die. At least the life can be saved. That is something.
What are you seeing in terms of the after effects of COVID once you get COVID? Some people are having a prolonged, symptoms like very small, like exhaustion a lot. So is that going to be prevalent for someone who gets COVID? Is there something that we can be ready for?
Probably because when even the literature says that the signs symptoms probably will last for long. But what thing I have seen is, what I think and I foresee is a lot of mental health issues. Because a lot of stigma is there, a lot of hesitancy in people, resistance in people not mixing up. Of course, people can't travel, right? So there are people have lost their jobs, people have lost, a lot of things have come with this COVID. The COVID has brought a lot of things to people, right? probably what I think is a surge in mental health conditions. And I was seeing the data 2-3 days back. They say the new strain, which the new strain is now, it's causing 22% of higher neurological problems.
Okay.
So that may be one of the reasons for the mental. Like for example, people will get going to anxiety, mood swings, depression. So that it's a mental health is one of the short surge which you will see after the pandemic.
Yes, so this would probably also increase the need of people talking about stigmas and mental health, which is not quite practiced in our country. So, as a state lead in infectious disease, do you also have these protocols for mental health coming out?
So mental health is one of the very skewed area, to be honest, in India, because there's not a first of all there is not a good a mental health professional. First of all, it's a psychiatrist, psychologist. It's approximately to serve just 1 or 2% population. For every 10,000 or 20,000 people, there's one psychiatrist. So that is something which government have to think. They have to do some bridging course, or they have to introduce some courses. At least to identify the people with mental health conditions. Just identification is important, critical component. Once the person is identified, then probably the SOP or something they can be laid out so that the protocol should be it can be replicated from state to state. But of course, we need first of all person to train them. The person who should be identified and that also majorly now into rural settings. Yes. Because many people have lost a job, they have migrated, like reverse migration came from urban and rural areas. And rural areas there is an at least access to health services. Forget the mental health, first access to, and then they are coming to the houses, they are starting everything from scratch. That is something a big challenge for the government to. Because when you say the people are reverse migrating, the government have to reverse the strategies. That are those things.
That's actually a very important point, because I never thought of it, because it's always that we speak about mental health, and there are only a very few people who actually understand and who have access to it. But now with the reverse migration and so many people going back, we have to also be very aware of it, and they also need to learn little more about it.
And the frontline workers has to be trained, because at the end of the day, they are the only people who they are in contact with, right? They have to identify probably, because sometimes if everyone, if you visit rural areas, so there are a lot of faith healers, there are a lot of traditional healers. So they will say, okay, koi isko bhoot aa gaya hai, or something aa gaya, they will say like that, right? It's very definite hurt, right? So they don't know what the problem is all about. So they have to go to the, at least we have to train those personnel to identify the problem so that they can be referred. As I stated before, we have everything in system in place in India, but only the challenge is the broken system, because the 3 healthcare systems, primary, secondary, and tertiary, when you talk about, there is no referral. The referral has to be there, right? The referral, the only gap is the referral gap.
And Doc, with the second wave currently going on, like there's a lot of limelight in media about how the nation has not prepared for it, and hospitals running out of beds, ICU allocation is not efficient, lack of ventilators, lack of oxygenators. So as I'm also part of this, I'm in the healthcare industry as well. So we get calls asking for 200 ventilators on a weekly basis, or oxygenators on a weekly basis. Why wasn't there enough preparation happening for this?
So that is something which I'll say again. It depends. First of all, what is your strategy, right? What's our learning from the first wave, right? See, everyone knows in India the health system is very broken. When you talk, as you all grow up, the facility. Like for example, I'm living in my area. I don't know the government facility, dispensary, the PHC or a basic dispensary where I can get free services. I'm not aware, to be very honest. And even I'm sure everyone is not aware of what service where the access has to be given, right? So and if you get access, you will not get personal. When you get personal, you don't get equipments, right? So it is a very it's not something which you can put. You say it's not something which you can blame one person. You have it's a system. It's a system failure. When you talk about a health system failure, it's a system failure. It's not one person failure, right? So government has to devise a strategy. So what my question to the government even the same is, like from 1 year what they have learned. There's a second wave now. What in 1 year what they have learned? What are their learnings, right? Because these learnings are the gaps. These are real gaps. Yeah. From this real gap, they have to close the gap. Gap is something which they have to close. And gaps are closed, then only a policy is devised, right? So policy making is something important, and policy making. See, everything is on paper, right? But majorly policy making is something which you have to implement also, right? Because, to be honest, currently even no one knows what the universe is, how many hospitals are there, how many private doctors are, how many patients. That's what I'm saying. That some few people, it's not about COVID. Probably they have asthma, they have TB, they have other disease. In fact, probably they're getting breathlessness or fever or anything. So people are linking everything to COVID now.
So what you're saying is very right, Dr. Rachit, because at least like what you said, we always go to our we never really go to our primary health centers, and what has happened very surprisingly in my family, at least, because in Tamil Nadu, people above the age of 45 can get vaccinated. Surprisingly, we found that we had till then we didn't really realize that we had a public health center right down our road in our area, and it was really refreshing to see that my parents could just go there. It was hassle free, and they could sort of get their vaccination in a matter of 10 minutes. And we rarely actually think about it, and as citizens also, we also need to become more aware and more adopt the idea that a public health center is not something that is lesser than your like you said, your tertiary or the bigger hospital that you go to. And that could be one way that we can also be responsible about how we don't overburden the system.
System plus, what I think is the government should at least geotag those systems, right? Everyone has these smartphones nowadays, right? So at least an app can be made. A person can find a nearby doctor or a PHC or CHC where they can go. At least the basic doctor name, mobile number, or email, or whatever. Probably sometime a teleconsultation will work, right? It's not about you have to go physically because of the COVID, but of course telemedicine is something which is coming up. People have realized the importance of telemedicine, but of course. That's what I'm saying, that to get the services, first you should know the universe. What is near to you? If you don't know the denominator, how you putting the numerator?
Yes.
You don't know the denominator.
Yeah, absolutely. So, Doc, how do you what do you see a way forward for 2021, and how do you see lockdowns coming in, and what are your views on? Is it actually necessary to lock down, or what are your views on that?
So lockdown is essential only just to stop the transmission chain. Lockdown will only, probably if you say, I was just reading the news actually day before yesterday. In 1 lakh cases in the US, it took 26 days. In India, it took 11 days, right? So because of population first is critical. Then secondly, lockdown will only help to, at least it will slow down the pace. It will not, I'll not say it will, decrease the transmission, to be very honest. It will just, for example, India underwent I think 4 or 5 months of strict lockdown, right? Where no one was. So if that lockdown will be helpful, why the second wave came up? There should be no second wave. The chain has stopped, right? So that is not something, the lockdown strategy has to be state specific. I'll say community specific, a block specific, district specific, or a state specific. It's their duty to make an action plan and then share and then work upon it, right? And I'll say in India, what public health has the biggest challenge is monitoring. The monitoring is a very critical component. You do any program, any implementation, whatever you do, there's a lot of issues with monitoring. Monitoring as it means real monitoring. It's not like you are doing monitoring for the sake of monitoring, but real-time monitoring, because from monitoring, if the monitoring is done, then impact has to be evaluated. The real gaps come in, and then you have to close those gaps. So what I think is it has to be state specific, it has to be area specific.
Yes.
And they have to do a contained zone, everything has to be contained.
And if you give out a brief advice to the public or population, and you want to put out an awareness campaign, or what would you put out on a billboard which is given to you?
I'll only just say, as WHO is saying, you have to maintain social distance. It's not about COVID, it's not about anything, it's about infectious disease, right? If it's TB, if it's COVID, it's any other infectious disease, you have to maintain social distancing wherever it's possible, because of course in India, everywhere social distancing is not possible, to be very honest. But of course, wherever it's possible, just maintain social distancing, wear a mask, at least, have some space, I'll say, good hygiene practice, as in when you are sneezing, put a hand, if you don't have any, mask or a handkerchief you can use on your face, and you wash your hands, because I'm sure COVID has taught people a lot about hand washing techniques, about hand sanitization. So it may have reduced many of the diseases also, to be honest, because people are now washing hands from 1 year, sanitizing, So that is something which probably COVID has helped people to reduce some kind of disease. But of course, this is something they really have to follow if COVID is there, if COVID is not there. These are something which we really all have to follow.
Thank you so much, Doc, for coming on board and giving us a in detailed perspective of what we should do. And thank you so much for your time. And I really understand it's extremely precious as well. Thank you.
Yeah, thank you so much. Thank you.
Thank you for listening to the 30-Minute Hustle podcast. You can follow us on Instagram for all our latest updates. Until next time, signing off, this is Pranab and my co-host Janish.